what happens to a person when they overdose?
The primary concern with an overdose is that when the quantity of opioid is too high, the person's consciousness declines, but also their breathing stops. And so opioids affect many parts of the brain, but in the brainstem, the lower part of the brain rests our breathing center, our respiratory center. And what opioids do is they effectively turn that off at high doses. And so if someone's got an opiate overdose, what you'll see is that not only are they unconscious, but they are breathing less and less frequently, and eventually they're not breathing at all. And the obvious consequences of that is that tissues like the brain don't get oxygen, and then they therefore die.
Now, he said that they brought him back. How would emergency doctors have done that?
That would be done with the use of a drug called naloxone, which is kind of the antidote to these opioids. It effectively kicks those other drugs off of the receptor and takes the place. It doesn't actually do anything to the receptor except occupy it. So somebody who's got an opiate overdose, within a minute or two of getting naloxone is wide awake and they are breathing normally, but they are also in withdrawal. And so more than once I've seen patients who have been on the verge of death, and we'll give them naloxone and they're now alive again, but they are in withdrawal, and they often...
Doctor forgot to mention that respiratory assist is the most essential part of it, because naloxone doesn't always work. Could be a polydrug overdose, could be fentanyl, which naloxone's hard to work against. And you got to keep the brain alive and every cell, tissue, and organ with oxygen. Ontario has taught tens of thousands of people to give chest compressions only for a drug overdose. All the signs and symptoms of a drug overdose mimic any of the other hundreds of causes of respiratory emergency. So a layperson's eager to do what a doctor tells them to do, and they're given chest compressions to other respiratory emergency patients. This is causing an increase in drug use and abuse, dysfunctional civilization. Every nurse, any 10-year-old child that takes a first aid course from St. John's Ambulance or the Red Cross knows poisoning, drug overdose, asthma, EpiPen, heart attack, stroke, choking. The list is endless. Give them air, because it's a respiratory emergency. In a drug overdose or any respiratory emergency, your heart don't stop till you're brain dead, lack of oxygen. Then pushing on the dang chest isn't going to do a dang thing except make sure you stay dead. So I've talked to ED nurses and paramedics. They're showing up to calls on a regular basis, people damaged from chest compressions. I says, why don't you say something? He says, oh Jesus, Gary, it's a monster. Well, you don't throw your women and children to a monster and say nothing. Sounds crazy. It's the only place in the world, and there's no place in medicine that'll tell you to give chest compressions to a respiratory emergency. Absolutely nowhere. There's about 8 papers that are in the medical literature, and they all come from Ontario. There's tens of millions, literally, of references in the medical literature. We've known about it for 5,000 years. Any poisoning, any drug overdose. It's just simple logic, buddy. So stop making yourself sick. They're killing yous all on purpose. 234 doctors wrote a letter to Kathleen, Wynne, and Dr. Eric Hoskins back in April, and got a response from the Premier. She'll get Mr. Hoskins to look into it. Anyway, it's a no-brainer. Stop making yourself sick.